Clear!
Welcome to Health and Wellness. My name's Will, Nurse Practitioner. When I tell people I'm a nurse practitioner, I often get, "Oh, that's awesome. When are you going back to get your RN then?" Or, "Oh, so now you'll become a doctor, right?" These responses are super common and nothing to get offended over. However, seeing as how I've been a nurse practitioner for all of a month, and I've heard these responses so much already, that tells me that there is undereducation on what a nurse practitioner is and what they actually do. A nurse practitioner is a registered nurse who has obtained additional education beyond that of a nurse, either a master's or a doctorate degree. This can take anywhere from 2.5 to 4 years to complete for most programs. The American Nurses Association says that nurse practitioners provide primary, acute, and specialty health care across the lifespan through assessment, diagnosis, and treatment of illnesses and injuries. Our advanced education teaches us many of the same things that medical students learn during their clinical years. We also have our nursing education and bedside nursing experience as a registered nurse to compound the formal education that we receive in graduate school. We learn about pathophysiology, which is how disease works in the body, pharmacology, which is how medicine works in the body and how we prescribe them. And we go through each system and disease, learning about the symptoms, diagnosis, and treatment pertaining to each specific medical condition. Once we graduate, we take a board certification exam. Once we pass, we are certified to practice in our specific specialty, whether that is family, adult, acute care, or many other specialties. So what does our job actually look like? It actually looks very similar to that of a physician assistant or a medical resident. It just really depends on the state and the facility that you work in. We often work in collaboration with the attending physicians who we can ask questions to or consult if needed. However, many states offer full practice autonomy to nurse practitioners, meaning they have been deemed competent to care for patients without physician oversight. So, are we nurses? Yes, but with advanced education and training. Are we physician assistants? No, but we perform similar jobs. Are we physicians? No. Our training looks quite a bit different, but we work in a similar capacity in many different settings and frequently work with them in collaboration to provide the best possible care for our patients. If you have any questions about what a nurse practitioner is or what we do, let me know in the comments and I'll try to answer them. Additionally, you can follow me at healthandwellness.org, where I post blog posts about nursing and medicine. You can also follow me on social media on Pinterest, Twitter, Instagram, and Facebook. Thanks for watching, guys.